Hi, this is Dr.Lokesh Edara. I am presenting in this video regarding the need of family medicine post-graduation in India. I'd like to share some my slides. So what is family medicine post-graduation? Most of us in India are not aware of family medicine residency program, even though in USA and Western countries is developed since 1970s. And they stopped giving a license for medical graduates. They need to do at least 2-3 years of postgraduate before they give a license to practice. So in India, there are either 2 years diploma course, which is now by DNB, and 3 years MD and DNB, MD by NMC, and which started like 10 years ago. And so what do? They're like a pediatrician. They spend few months with pediatric floors and outpatient, OBGYN, they deliver babies, surgery, they have surgeries for and also general medicine and ICU. And of course, other months they're basic care for orthopedics, ENT, ophthalmology. So it's a clinical practice, it's mostly outpatient practice. They do emergency care. What is the family medicine? Why each citizen need family medicine for graduate care? MBBS graduates, they just have enough theory knowledge, but not enough clinical exposure to patients. And even MBBS is acceptance by patients also very low. And there's so much talent of MBBS which are not given postgraduate opportunity and serve nation. So family physicians possess distinct skill knowledge because they are treating from children to adults. The specialty is comprehensive medical care. Comprehensive medical care. They're not just treating one part. Health maintenance and preventive services, which is a major burden on India. Patients are every demographic, across the range, children to adults, OBGYN, everyone. Rural, urban, which is very ideal for the India. And you see non-communicable diseases account for 5.2 million deaths in India. So a family medicine postgraduate long-term patient relation. So patients trust the family doctor, global proficiency, and best position for lead patient care teams. They help with good continuity of care and prevent fragmented care. And they evaluate, treat patient all ages, range from newborn to elderly. Geriatrics, preventative care, and you have geriatric care and palliative care. They can treat small initial fractures or sprains and refer to the orthopedic specialist. And if they're in a small town, they don't have orthopedic doctors, so the family medicine can do primary care, maybe splints before they send to the specialist. And some of a lot of rural areas that don't have OBGYN, they can do preventative primary OBGYN care and deliveries. Chronic illness, a lot of diabetes, high blood pressure, high cholesterol, treating the cholesterol, heart failure, coronary heart disease, you name it, so much management, need expert, 3 years experience. This is not from me. This is from a professor of Minnesota in family medicine. All family medicine can see one physician for 90% of their care. 90% of the care, all family members, except in the hospitals. A developing country like India with a population of 1.4 billion will benefit training family medicine postgraduates physicians to improve healthcare of people in all India at lower total cost than current specialty-oriented model. There's so much money spent on the unnecessary labs, unnecessary procedures, but family medicine physicians can able to tailor. Establishing a family medicine program across India is well train a new generation of physicians to provide comprehensive medical care. So this is the take-home message. 90% of their care can be given by a family medicine doctor, 90%. So every Indian citizen deserves to be under care of postgraduate. Like USA, UK, they already moved to this models, protocol-based, and their outcomes are much better than USA. Actually, the cost of spending in healthcare is less, but people living longer than in USA, especially UK and other Commonwealth countries. And Niti Aayog in India proposed 100,000 postgraduate. So we have only 55,000 postgraduate seats. So rest of the 50,000, what is the policy? We need NMC and NBMES could make a committee to see which specialty need what percentage of PG seats. I think family medicine is up there needed. And 150,000 MBBS students have no post-graduation seats available. And how many people take PG NEET? 206,000. But this will grow more because last 5 years, the number of PG seats went up, MBBS seats went up significantly higher. Mandatory family medicine department, what the state government role? The state government has significant role. They can pass GO to all government medical colleges in their state. Please start a family medicine department, a 30-bed unit, and a professor and assistant professor, associate professor, ready to go. And state governments, all private hospitals should send a GO, please start family medicine department. And state government should start private hospital, currently 100-bed hospital, please start DNB because 3 years program, because most of the private hospitals do get funding from state governments. And state governments, DNB 3 years course family medicine, government district hospital, somehow states are doing much better than others. So I think we need all states to look into this. And also, please advocate. All the state governments should write letters to Central Health Minister, Chief Minister, Health Minister of state government can write the letters, and health secretaries, Central Health Secretaries, starting a mandatory department in family medicine by NMC. Then the regulations easy. Recently, emergency medicine department started, which is taking across very well across India. So national medical boards have a significant role in family medicine. They are already doing great job. They started diploma in course. Diploma 2 years is the same thing, which is in Canada, 2 years diploma course in family medicine. But not all states are taking up process. We need around 15 to 20,000 PG seats, and we only have less than a few hundred. So let's go to the number, 206,000 people in MBBS graduates competing for 51,000 PGs. So still 150,000 left without PGs. What is the model? Even with mandatory family medicine, PG seats could be maybe 3,000 to 4,000, or even DNBs could go another few thousand. But what do we do with 100,000 people? We cannot create PG seats. So there is a good model, an alternative model founded by UK, Canada, and what they do is either after 3 years working in the PhD, then they give 2 years, so they have to enroll to the program. They do the modules and examinations, and then after 2 years, so this after 5 years of MBBS, you're eligible to take diploma examination. You don't need to be PG NEET, you don't need to be trained program, but this is other model. That's probably the best model. We need NBME to look into that, help us. Otherwise, we're not taking the help of these hundreds and thousands of MBBS physicians, not getting into the postgraduates and taking care of my family, your family. And the cost, this program cost is the least, which is most of the rich people can able to afford the postgraduate seats. Intelligent people, high smart people get it. But what about the other rest of the 50% of the MBBS students? And they may be poor, they may be not able to get a postgraduate. In the USA, central government gives everybody salary for the postgraduate fellows and super specialists. But in India, 50% is borne by state government, other 50% is borne by students. But this model can help us graduate with the least expense and then serve the people, which they're supposed to. We also want to request NBME to give permission 50-bed national NABH hospital, 3-year DNB family. There are many 50-bed hospitals than 100-bed in India, because establishing 50-bed hospital is very, very burden to the doctor. So, but make a fixed rule that 50-bed hospital should only have family medicine postgraduate, nobody else, not general medicine, not the pediatrics, nobody else, only family medicine. So all the patients belongs to those postgraduates. Minimum give 6 seats per year or 4 seats. So 12 members rotate through, and they affiliate a local pediatrician, OBGYN to get enough exposure to all other specialists in the town. So that will help a lot of postgraduates coming out through across the country. So this is a special request for NBMES on Mandatory family medicine is very, very important. And NMC Gazette, which is the law of the land, says section 24, they ask for dynamic curriculum, primary health center, community medicine, family medicine, and healthcare in such areas. That's number one. Number two, in order to do the curriculum, you need a department. Community health department is different, but family health is 100% is clinical care. And section 25J also promote and facilitate postgraduate course in family medicine. We need a family medicine department to promote postgraduate. Otherwise, they won't give their own NMC. So people are not, medical colleges, private, government are not starting it, even after 10 years. I will show you the numbers. Here, 10 years. When did the family medicine MD introduced by MCI? 2012. How many years so far? 10 years. How many medical colleges? Now we have 648. How many medical colleges started the program? 7. 7 programs develop family medicine, 13 postgraduates. Out of 98,000 MBBS students, 13 postgraduates in MD seats. That is the current situation. That's why the NMC Gazette, if you follow them, if you made them mandatory, like you just did it a year ago, emergency medicine, now all the departments started. So once mandatory family medicine is very essential to develop the family medicine, healthcare, preventive care burden across the India. If you look at Canada, 40% of medical graduates go to family medicine in India post-graduation. In 13% of medical graduate family medicine in USA. USA is not a real good model for the universal healthcare. The most good models are UK and Commonwealth and other countries. But only mandatory medicine, mandated department in family medicine can fulfill NMC Gazette requirement and is good for the health of the India and common man, your family and my family. Family medicine USA, just to spend a little time, 13% of medical graduate school enter family medicine. In University of Minnesota, 35% graduates pursue family medicine. The rural area, they pursue more. So in USA, out of 300 million people, 1.18 lakhs family medicine physicians, which are postgraduates, which started in 1970s. And imagine India with 1,400 million people have how many need. One good thing is Niti Aayog want 100,000 PGs. So rest of the 55,000 PGs, we need at least 15,000 should go into the MD in family medicine. That means every medical college should have the department. The mandated department is a must. Canada, look at Canada, and they started 2 years program, shortest program in the world. You can structure program, or you can have practice 3-4 years. Then you can do alternatively, you can enroll and take the eligible. 40 to 50% female family medicine postgraduates in Canada. And once they take the examination, almost 82% of them Canada board certified exam pass. Foreigner students are less, but local graduates pass 90%. So even India, they can have our own graduates pass 90%. So I'll stop here. And this is a basic summary of why we need family medicine department. Post-graduation is so essential to help Indian healthcare. That's very, very essential. Thank you. This is Lokesh Edara. Happy global medical education.